Hello, hello, everyone. Welcome, welcome. We're going to give folks a couple minutes to trickle on in here. But in the meantime, I would love it if everyone could introduce themselves in the chat with their name, organization, or campus. And I would love to hear, since we are on the topic of health, one thing you do for your health, whether it's something you do every day, something you do a couple times a month or once a year. It can be something small, something big, but would love it if you all could share your name, your organization, and something that you do for your health. I think especially during the pandemic, focusing on our health is very important. Awesome. Oh, see some things trickling in the chat here. Tony's a swimmer. Awesome. Yeah, great for the lungs, cardio. Aaron likes to get outside on his bike. Nice. Monica Souza does an annual girls trip. Yes, mental health is very important. Seeing those folks in our lives. Exercise 4 or 5 days a week. Welcome. For folks who are just jumping on board here, we are going to go ahead and get started in a few minutes. But in the meantime, would love if you all could introduce your name, your organization, and something that you do for your health, small or large. For example, Alicia takes daily vitamins and Rochelle rides her horse. So health is a broad spectrum there. Awesome. Oh my goodness. Someone listens to Pandora comedy shows every day. Nice. Taking walks with the dog. That's something I do too. Welcome. Looks like we got some more folks trickling in here. For those just joining, if you could introduce yourself in the chat with your name, organization, and something you do for your health. Seeing lots of vitamins. Awesome. Lifting weights. Yeah, got to build those muscles. I saw someone in the chat saying they should ask their students what they should do for their health. Maybe they'd have some good recommendations for you. See, walking at the river, Julie, awesome. Yes, Rachel, I would agree that having Spotify alone or Audible alone in the car are great to like decompress. That's one thing I miss about the daily commute to and from work, just listening to music in the car. Yep. All right, welcome. We'll give it just one more minute for folks to jump on. For anyone who's coming on now, if you could introduce yourself and say something you do for your own health in the chat here. But I think we will go ahead and get started in just a moment here. All righty. Well, welcome all to our Regional Health Advisory. Great to have you all here with us. Before we get started, I just want to go over some brief housekeeping. I think we're all doing well at this today, but if possible, we'd love if you could enable your video. That's great for engagement, and we want to see all of your lovely faces. Please go ahead and stay on mute unless you're called on to ask a question. We will have some time for Q&A and some interaction there, but until then, please stay on mute. And then if you have any questions or commentary during the event, please feel free to put that in the chat. We find the chat at these regional advisories are fairly rich, lots going on, lots of connections made. So I'd love to put that in the chat. And just to let you all know, I think you probably got a notice as you joined on, but this meeting will be recorded and it will be provided as part of the post-meeting materials. So we'll have the whole meeting recorded for you. And then moving forward here, I will pass it over to Renee John at Valley Vision to kind of do a little welcome and get us started.
You want to meet?
Thank you, Caitlin. Welcome, everyone. I'm Renee John. I am the project leader at Valley Vision. We're a civic leadership organization, and I oversee our workforce portfolio. It's our great privilege to bring sector advisories to you all in different growing and opportunity sectors. Of course, we know that healthcare definitely has a lot going on. I'm joined today by my co-host, Julie Holt, from the Los Rios Community College System, and I'll let Julie say a few words.
Good afternoon, everybody. I am very happy everyone could join. I do realize it is a very busy time of year for our healthcare partners and our education partners. I am Julie Holt. I'm the Regional Director of Employer Engagement for Health for the North region. So that's Greater Sacramento for 8 colleges. And I'm very pleased today for us to be convening together, just really looking at what our goals are today, We really want to understand from our industry advisory partners here that are going to be joining us on our panel, what are the connections that we can do better in our education programs? What gaps are there to supply the workforce at the present time, and then also thinking forward, and then also how we can strengthen those partnerships between education and our employers and industry partners. So we're very pleased to have a great representation today from public health, our FQHC partners, and many of our large hospital partners, as well as some long-term care representation. And with that, I'll hand it back to Renee, and she can introduce our next guest.
Thank you, Julie. A great introduction to the event. This event is supported by Los Rios Community College District on behalf of the Far North Regional Consortium of Community Colleges. There's also support provided by the workforce boards that make up the Capital Region, and you see their logos there. We also have Centers of Excellence, which supports these advisories with labor market and job posting research, and we'll be hearing from Aaron Wilcher a little bit later. And this is provided by strong workforce program funds, is what allows us to bring these advisories to you today. So on our next slide, we have the agenda that you may have already received by email, but here's a brief overview. We're of course doing the welcome right now, and if you've joined us late, we would like to ask you to introduce yourself in the chat and share something that you do for your health. After the overview here shortly, I'll hand it over to Aaron Wilcher, who is the research director for the Center of Excellence, and he'll provide us with some demographics, labor, and occupational information. Then we're very pleased to be hearing from Carter Todd, who is the president of the Capital Black Nurses Association, along with many other designations. He has more letters after the end of his name than I have seen in a full alphabet. So we're excited to be hearing from him today as our keynote speaker. And then we will have a panel discussion, and we're so thankful for our industry and employer panel for sharing time with us today to help us understand what is new, what are the trends in the field, and how we can help with the employee shortage gap and pipeline issues for health and allied health careers. And then Julie will wrap us up with some highlights of what the community colleges are currently offering in this region and opportunities to partner. We thank you for joining us today and spending some time with us on this. I will now give the floor to Aaron Wilcher.
Hi, good afternoon, everybody. It's great to see so many education partners and industry partners on the call. And I'm going to be providing an overview of labor market information in the health sector for the greater Sacramento region. So thanks to Valley Vision team, Renee, Caitlin, and others, and Julie for giving me the opportunity here. And I'm just going to be asking for next slide as we go along here. Maybe we'll just go to the next one. So I'll briefly describe our program. I cover the greater Sacramento region, which is a 7-county region, typically as we define it, which is our Council of Government planning region plus Nevada County. That also covers the geography in which we do research often. And as I'll explain, some of the data that we're going to look at describes employment in that 7-county region. So our program, maybe we can just go back one. So our program is, as Renee mentioned, technical research and engagement services for the California community colleges, but also regional partnerships, such as the one that we're working on today with Valley Vision and all of you. I am one of 8 offices around the state, and we're covered under the Economic and Workforce Development Division of the California Community College System. So you could see my colleagues there around the state who all do similar work as I do. Now we can go to the next slide. So, just getting a little bit more into our work. The colleges, as I'll tell people at dinner parties, want to know about the jobs picture. And but it encompasses kind of a number of different research areas and types of research questions that we have. You know, what is the employment outlook for students? What are the skills and credentials that are required? What types of programs look ripe for investment? And the array of kind of ways that we do that research, and other kind of ancillary questions that we ask. And as I'll describe, the healthcare sector and the related programs are present kind of infinite opportunities. I mean, I think we rely on programs like this to figure out where the specific opportunity areas are, but healthcare is generally a really good bet when you're looking and talking about like a portfolio context from senior leadership level. Next slide, please. So I think I often think of our work as kind of a mixed methods approach. Data tells you a lot when you're doing research from the desk, but there are limitations. And so we want to do programs like this, interviews, surveys, and other kinds of work to figure out exactly what the best bet is, and make sure that we're verifying the different data elements that we have. So in a way, what we're up to today is also research. And again, I think of things in a kind of a mixed methods process. Next slide, please. So I'm going to talk, kind of give in a way, a 15,000-foot level of data, what's going on in the healthcare sector in the greater Sacramento region. And that'll consist of some industry data, as well as data from a tool that we use whose name I love. It's called Burning Glass, where we can pull reports in a kind of a cross platform manner to get reports on what's going on with jobs postings from employers. And then I'll describe a little bit about our educational portfolio and some other data that we're going to share with you as we leave materials behind from this event. Next slide, please. So first we'll talk about the industry, and I'll just give you sort of a broad overview. So when we look at this sort of major sector in our Sacramento region, we see, this huge number, 109,000 jobs, more than 109,000 jobs for the 2020 year. It's the most recent year that we have this industry data available. That's comes from payroll data getting shipped off the EDD. And, if you think about the total economy, it's just over 1.2 million jobs in the 7-county region. So another way to think of this is that the healthcare sector represents 9.1% of the total jobs in the regional economy. I mean, good news here, even in spite of the pandemic, this 13% projected growth rate is really pretty strong. As I'll describe in a little bit, we've been watching annual numbers as well as monthly jobs numbers, and certainly seeing that healthcare is tracking strongly compared to other sectors that have had some challenges. I mean, other sectors that are doing well include like transportation and warehousing, construction, and so forth. But overall, this is really good news in terms of the impacts that we've had, and we'll see a little bit more data about this. The bottom number there, still maybe on the previous slide, please. There we go. So that bottom left-hand number, the 9,325, that's occupational projections. So that's the number of annual openings that we project over the next 5 years. And we use a software, EMSI, to provide us with that projections data. The average earnings, very strong, again, in comparison when we look at a comparison to other industry sectors in the region. This 101,000 number is quite strong. And again, another reason why we encourage our students when we look at kind of a macro level, this is a really good area to get into if you're thinking about a career path for that reason. Next slide, please. So we have some demographic data here: race and ethnicity, gender and age. You can see from the race and ethnicity standpoint, the largest category identifying as white alone is about half of the healthcare sector, followed by Asians at about a fifth, Hispanic or Latino at 18%, African Americans about 7.5%, and then other categories, 2 or more races, Native, Hawaiian, American Indian, so forth. Predominantly female, 3/4 of the healthcare sector is categorized as female. And then I just point out, typically when we look at age breakdowns such as this, we're often paying attention to those right-hand categories with respect to potential retirements. Most sectors have large shares of their jobs are, with retirement age populations. In this case, it's about 1/4 of the healthcare sector is in that 55 and over category. So just like every other sector, most sectors, retirements are a concern in terms of replacing jobs and developing pipelines. Next slide, please. So this is just another way to think about the 109,000 jobs that we looked at in thinking about the breakdown. So the definition that we are using from an industry standpoint, if we roll it up, you can see a split of the types of sectors in healthcare here. So ambulatory healthcare, that is like outpatient clinics, offices of physicians, other types of clinics, represents 60,000 of those 109,000 jobs. Hospitals at over 27,000 jobs. Nursing and residential care, about 20,000. The shaded green area are the 5-year projected growth in the total number of jobs over 5 years that we're going to see. And then due to a quirk in the definition, that drug and druggist category is like the retail category within our definition. But this just gives you a sense of kind of what the breakdown is of the type of industry sectors that are there. Next slide, please. So, we watch these jobs numbers on a month-by-month basis, along with other industry sectors. And I just point out that, again, healthcare tracking quite strongly with comparison to, let's say, hospitality and tourism that lost literally half of its jobs overnight between early 2020 and then April 2020. That number, this is an index comparing the greater Sacramento region to California. So greater Sac represented by the orange column there. And, what you can see is that the drop off was significant, but not severe, I guess I would say. So, in April 2020, that number means that in the greater Sacramento region lost about 8.5% of its jobs. But then the recovery looks pretty good. It didn't seem to track down from that when you look on a monthly basis. And then the month that we have for most recent data, August 2021, Greater Sac is down just about 3.5%, whereas California is down just about 1.5%. Healthcare, generally speaking, is considered locally serving by and large. And so normally we're going to expect to see employment rise with population growth. And, so this does mean that there's been some impacts to the healthcare sector, but it hasn't had the kind of impacts that hospitality has had. something we might want to talk about in the panel discussion, what that's looking like on the ground for employers. But generally speaking, with comparison to other sectors in the economy, healthcare has weathered the recession pretty well on the whole, according to this data. Next slide, please. So now we're looking at, this is this burning glass tool. So one of the types of analysis that we do, just as in the previous slide, is to look at jobs postings volumes in certain geographies to see, you know, what this looks like as another indicator for demand. On the whole, so you can see the dashed orange line there is the stay-at-home order right at the outset of the pandemic, the beginning of 2020. And this is an index just like the previous chart. And so after this kind of dip towards the beginning of 2020 in April and May, on the whole, jobs postings volumes when compared to January 2019 have been 50 to 70% higher on a month-by-month basis. There's this spike in the summer of 2021 where you had 100% higher jobs postings volume. Again, this is just another indication that healthcare with respect to demand is strong. This is showing that there's a lot of hiring going on, and it could be indicative of other challenges. We note this type of volume increase in other sectors and reflects typically hiring challenges. Next slide, please. So we do what's called staffing patterns on the industries that we researched, and that enables us to look at occupations within the industry. So this is just a little bit different way to measure the labor market, but this reveals the kind of demand occupations, or the types of workers that are in demand, are prevalent with respect to the numbers of jobs within the industries. And this is all kind of what I would call like standard fare in terms of labor market. These are jobs that are very frequently and in demand. That this is kind of not surprising or anything new, but just gives us, some data to support that these typical occupations that are targets for education and training programs are still present, still there, still in demand. These are middle skill occupations in the sector. Middle skills defined as those occupations requiring more than a high school diploma, but less than a bachelor's degree. And I just point out that this is just a list of the top 10 occupations, middle skill occupations. And so there are many more occupations that middle skill included that would be targets. It's just, we just show a top list of occupations. We have another resource we'll look at in a little bit that has a little bit more comprehensive list. But what's included here, I'll just sort of run through this really quickly: RNs, medical assistants, nursing assistants, dental assistants, LVNs, medical records specialists, dental hygienists, rad tech, EMTs, and so forth. Next slide, please. So now we're looking at what we're calling high skill occupations. So these are occupations requiring a bachelor's degree and above. Same thing here. This is sort of, your top 10 list of demand occupations based on the staffing patterns of healthcare industry sector. And what do we see here but large numbers of jobs in demand for financial services managers, data analytics, management and project management, counselors, and dietitians. So, kind of a top list here. Next slide, please. So diving in a little bit more to the jobs postings, we had that previous chart where we looked at jobs postings volumes, but there's other things that we do with this tool. And you're seeing that list here. Again, a kind of a top 10 list of employers posting over the last 2 months in the greater Sacramento region, the top occupations and the top certifications required. So on the employer side, large healthcare organizations, hospitals, senior living, we often see that's not uncommon for us to see that top level, including services for the elderly. On the occupation side, I would just point out, this list should look familiar because we just looked at it. When we look, so this is basically verifying the occupational data. In other words, from a separate independent source, we see these kinds of occupations in demand also, just reinforcing and verifying what we've just looked at. Sometimes we look at this data like comparing one quarter in 1 year to another, but in this case, we just for the purposes of this presentation, we just looked at the last 2 months. Next slide, please. So another kind of report that we get looking at these top occupations shows job posting intensity, but also the time to fill the position. And generally, one way to think of that is just the length of time that the postings in those categories are staying on the boards as kind of an average. And so you can see here that, what Burning Glass is designating as the level of demand is high and very high in these areas. And, another way to put that would be sort of, hard to fill positions. Next slide, please. And then the next one after that. So in terms of educational supply, we're going to be looking at some numbers here in just a second. But basically, again, along with this being sort of critical sector in our economy, we are well resourced in terms of the number and types of programs and sort of, number of institutions in our region that has healthcare related education and training, going from our community colleges, Los Rios and the Sierra and the Yuba Sutter district, our private college providers like Carrington and others, four-year universities, and then there's a category there for Charles A. Jones. So just this displaying the number of institutions in our region that have education and training. On this next slide, I just want to point out that this link, which I'm hoping we could paste into the chat as well. I think we may be following up with this resource as well. And maybe Caitlin or someone else. We want to make sure that you have access to these materials coming out of this this presentation. The material that I want to share with you in the link, thank you, Renee, for clicking on that. I'm wondering, Caitlin, if we could maybe just show folks the resource that we're offering here, and I can explain a little bit about it before
absolutely.
signing off.
Angelina is screen sharing on our behalf, but she has that PDF up here.
So I'll just sort of cue this up by saying that, we looked at two different data sources that showed us the demand in some top occupational categories, both from the occupational side of the house, but also the jobs postings part, looking at volumes, and another hard to fill report. This analysis that I want you to be able to take with you is a little bit more comprehensive. And essentially what this is what we call a supply and demand gap analysis. That is to say, we will often put together the number of annual openings that are projected over the next 5 years next to the number of annual awards that we average over 2 or 3 academic years. So let me explain that as the graphic is showing. just to ensure we have some understanding here. The blue bar represents the number of awards. The dark blue are community college awards. The light blue, I believe, are four-year university awards. And then you compare that to the number of annual openings in the yellow bar that are projected, which we call demand. So essentially the idea here is you look at that difference between the yellow bar and between the blue bars, and lo and behold, most of these categories show a huge gulf between the number of annual openings, which by the way is expressed as growth in that occupational category, in other words, new jobs, and retirements and separations. So what our sources are projecting are the number of openings in the greater Sacramento region and then the number of awards. So lots of demand here. I mean, the bottom line is most of these categories show a huge delta, huge demand that we're not adequately filling from an education and training point of view. So again, the big picture is there's lots of demand, lots of opportunity, lots of need to grow programs. And we rely on partnerships such as this, our employer partners and others to help us shape those investments to try to provide our students with good jobs, to supply the needs of industry. And with that, I will allow the group to sort of take it away from here. I'm happy to take any questions if there's time, although I think I might have gone a little long. So
No, actually, you are okay, Aaron. So if there are any questions, you can put them in the chat or you can raise your hand. How do you determine the college output levels?
yeah, there's I guess Dr. Grant, I will answer this. Let me know if this answer is not what you're looking for, but I'll answer your question by mentioning the sources for the data. And you know, here we're counting the number of awards on an annual academic year basis. And there are two sources for that. One is our community college chancellor's office that rolls up data from the individual campuses. That source is called Data Mart. And the other one comes from the Department of Education at the federal level. And that's where our software, EMSI, is able to count data, and that's frequently from financial aid records. And then we calculate the annual, we will calculate the annual numbers on that basis by institution frequently and by program area that corresponds. Does that answer your question, Dr. Grant?
It'd be fine just for Grant. It does, Aaron, but I just want to make you aware, and you probably already are, that number is wildly inaccurate on occasion, given some of the chaos we have in collection at the local campus level, and really the definition of credentials or credit hours. And so there's a lot of, I think, output that the colleges provide in credentialing and certifications that don't get accurately collected. And so I would say that gap analysis that you just showed us is not completely accurate. So I don't want our employers leaving this wonderful meeting with the idea that we're not busting our backsides to try to meet that gap. As we meet with our advisory councils, oftentimes they make it very clear to us that they have increased demand. And that's probably one of the greatest ways that we can see our course sizes increase, is when we can take accurate data from our employers to our administrators and show them that at a very local level, there's a gap there. And this particular gap analysis oftentimes is so flawed that everybody in the system knows it and then kind of discredits it. But if I have a letter from an employer saying that they've got 200 job openings, that strengthens the argument. So I just wanted to see what we're doing as a system to try to more accurately reflect that gap analysis, particularly, honestly, as we head into some pretty interesting times in the next maybe 2 cycles in our enrollment in the community college system. How are we going to address when FTE is potentially being reduced, enrollment is down, and yet we've got employers telling us that they've got immediate job openings, and the frustration that creates. Thank you.
Yeah, and maybe just a quick response is I appreciate the comment, and certainly all data has its challenges, including the demand numbers for annual openings. And I think what I would say is your point's well taken, and I think I'd sort of go back to my opening comments in terms of a mixed methods approach, and that is to say, when looking at particular opportunity areas, identifying messages such as the one you've just provided, attempting to fill in the gaps where they exist, and then I think what you're talking about with employer messaging could also be described as sort of ground truthing the data, but where we know that there are clearly, like, let's take medical assistance as a one example. We know there's like tons of credentials issued that are not captured, and so I think, like Julie, you remember a few years ago we did a project in which we actually went out and asked training providers to tell us how many awards they issue on a basis. So so I think what I would say is yes, I totally agree with you, and I think we want to use those things as a starting point and not as a the Bible or something with a 10 commandments type of approach, but using it as a starting point, filling in the gaps where we can, and then using employer information broadly can conceive to ground truth where our investments should be going, if that's an okay response.
Thank you, Aaron. I think, that's why we're here. We do the data as well as the employer industry panel because, we do the best we can with the data, and we thank you for the information that you brought forward today. And then we get the on-the-ground experiences from our industry and employer partners. So not seeing any other questions right now, we will move on to our keynote speaker. Thanks so much, Aaron, for providing the information to us. I want to introduce to you Carter Todd. He is an assistant nurse manager at Kaiser Roseville Medical Center and the current president and founder of the Capital City Black Nurses Association and current fellow of the American Nurse Association, California, in their policy and advocacy initiative. His route into the nursing profession has taken him through all levels of the California education system, including Merced Community College, Sacramento State University, California, Samuel Merritt University, the Betty Irene Moore School of Nursing at UC Davis, and he is a recent graduate from the Western Governors University with an MBA in healthcare management. The Capital City Black Nurses Association has grown with over 60 members and 7 newly minted lifetime members and growing roots within the region. He enjoys community organizing, healthcare educational projects, and spreading all the amazing benefits that nursing has to offer. Carter is a recent recipient of Sacramento Business Journal's 40 Under 40 Award, the Association of California Nurses Leaders Emerging Leaders Award, and the National Black Nurses Association 40 Under 40 Award. He is a proud father of 2 small children and acknowledges that his amazing wife is the true star of the show. So I will hand it over to Carter to provide his insights into the nursing profession.
Thank you very much, Renee. I appreciate it. If someone can let me share my screen, then we should be able to rock and roll here. I have 20 minutes. I'm in my scrubs because I do have work a little bit later. as Renee introduced me. But thank you very much to Caitlin and Renee for putting this together. Looking through the roster, there's a lot of great educators and healthcare leaders here. So really honored to be a part of you all today. And then of course, Julie, you are amazing. Every time I run into Julie, I think that she is a good representation of how you really put your money where your mouth is. You spend the time, you make the relationships. And I feel like the way that she goes about her business is something that we all could really follow. So thank you, Julie, for the invite. So I have 20 minutes. I talk a lot, so jump in, cut me off. I get really excited when I talk about nursing. Following Erin's speech or presentation made me happy that I chose a good profession, because registered nursing are at the top of almost all of those demographics. So I'll try not to bore you too much. We'll jump into a quick PowerPoint. I'll show some videos and then hopefully inspire you all to see, well, you already know how amazing that this profession is, but maybe answer some questions for you. So I'll just be talking about my research, barbershop talks, and then more importantly, opportunities and initiatives. As Renee said, I've been through before I go, no financial support was given for this. These views are mine and mine only. I am currently the president of Capital City Black Nurse Association, so I will be strongly biased towards that organization. So where are we? I'm a registered nurse. I remember very vividly the first time a COVID patient came into my unit. I was working bedside the pediatric ICU at UC Davis, the sick of the sick. And the doctor walking in and saying, "Stop, everyone put on your goggles." And, there's 12 of us in there, we're doing our thing, saving lives. And I will never forget that feeling because of how odd it was. It was so odd and nothing was ever the same. Fast forward to now, 2 years later, we're on Zoom. Our students are on Zoom, right? The projection and the job outlooks are different. Nothing has been the same. You topple that with the social unrest of 2020, 2021 with the murder of George Floyd. And it has been an absolute powder keg in this country. And so I just want to acknowledge those who have lost loved ones, those of us who are fighting on the front line. I took a job as an assistant nurse manager last year in the COVID unit at Mercy San Juan. It is real, people. So anytime I get in front of a camera and have the opportunity to talk with folks, do take care of yourself and make sure that you're being safe. So a little background about myself. As I was introduced, I've been all over the California education system. Junior college was my friend. I was a knucklehead out of high school. I played sports initially, but I always wanted to be a nurse. I'm very fortunate that our beautiful state had so many opportunities. Came to Sacramento about 12 years ago. Always wanted to be a nurse. Fortunate enough to make it. And I've just been really trying to jump through every just opportunity that I have. I think that's really my goal, is when you have something open to walk through it fully. So how did we get here? From a nursing standpoint, Florence Nightingale, right? That looks like a picture of me on the bottom right, right? You're your bedside nurse. Wrong, that is not. I've never worn a bonnet, nor have I wore a dress when I'm working as a registered nurse, but we've been around for a long time. As you all know, I think we're at 15 years running. We are nationally recognized as the most trusted profession in the nation. And I will say the outpouring of support during the pandemic, we felt it. So thank you all. If you sent messages or you sent food or you checked on your healthcare loved ones, we do appreciate it, because it was beyond hard, right? We have children at home, we have lives, but we're also walking headfirst into something that is terrifying, that is unknown. And acknowledging that for your students. Particularly those going into the healthcare profession, they're going into it knowing that they're fighting a battle, and it's not the most ideal time, but they're still doing it with valor. And I think that we owe them a little bit of grace. I know that you all have probably given a lot of grace over this last couple of years, but just remembering the gravity of what this last couple of years has been. I know I was talking to a friend, and our minds do this really interesting thing of kind of warping the reality so that we can cope. But we all remember when there wasn't toilet paper, and that wasn't too long ago. So Healthy People 2020 defines health equity as the attainment of the highest level of health for all people. And health equity is something that I believe nursing, education, industry is really focused on post kind of George Floyd and this pandemic. There's tremendous work that was done before. I don't want to discredit, the DEI initiatives before, But my experience being in the hospital, being in healthcare, being already a president of ethnic-based nursing organization, I know what it's felt like. And a lot more people are paying attention now. This is great. I think that this is actually a huge opportunity, right? Whenever something bad happens, there is, the silver lining that can become from it. And I think that, there is a tremendous kind of emphasis to make sure that health equity is given, not just in the classrooms, but through our healthcare systems. And nursing has done a really good job of kind of piloting this throughout its whole profession. And why does it matter, right? Because patients receive better quality care from a diverse workforce. This is a known fact. Representation matters. I give the example. I'm going to talk about the barbershop. So any of you on this call, you walk into a black barbershop and sit down tomorrow. Are you going to feel comfortable talking to someone next to you? And be completely honest with yourself. It's okay. So for our healthcare workers, our colleagues who walk into the job setting, correct? Or they're on a Zoom and they're having to conduct themselves in a quote unquote professional manner. Do we feel comfortable? Are we going to get the best out of our employers? Are we going to get the best out of the situation? So understanding that, making a seat at the table, I think that nursing has a phenomenal opportunity to do that because of how much people trust us and because of how intimately in touch or have the pulse of our patients. That was the only bad pun that I'll have. I'm sorry. And it's an obligation. I love this profession. As you can tell, it's given me everything that I've ever asked for and some. And I feel like it's our duty because it is our scope of practice. All those healthcare opportunities and professions that were listed on the previous presentation, they're amazing. They're great. We need everybody. My own belief is that the nursing is the core. We are the glue of the hospital. My wife's a physician and I give her a hard time because I say, I do more than you. No, I'm just kidding. But really anyone who's worked as a nurse or, unfortunately, if you see me at work, you know just how many hats that we wear. We are your physical therapist. We are your dietitian. We are your care planner. We do it all. So we have a phenomenal chance to kind of touch a lot of people. All right, 7 minutes in, I'm doing all right. So we had a good outlook for kind of the job outlook earlier in the presentation. This one's specific to nursing in California. This was pulled from the Board of Registered Nursing, the latest report that I could find. So this is just a demographic breakdown. The last numbers I saw, so registered nurses in the state of California, I believe we're close to 500,000 registered nurses. So over 400,000, which is a significant amount of people, of trained people. And it's not enough, folks, because the changing demographic of our nursing workforce is that the baby boomers are retiring. This pandemic has pushed people to retire earlier, and it's not an easy job. I'll be the first to say it. It's harder than I thought it was going to be for a lot of different reasons. It is extremely stressful. You're dealing with life and death. Not every nurse does. I just, preface that not everyone worked in the pediatric ICU. Not everyone even works in a hospital. I think only 60 to 70% of registered nurses actually work in a hospital. But it's not an easy job. So we have to remember that when our students are aspiring to be realistic. I say that because I have my cousin living with me and she's currently trying to become a nurse. And we have a lot of real conversations about what the opportunity and outlook is with you all, right? How many seats do you have in your programs? How many people are applying and not getting accepted? Even though from a manager's standpoint, we can't get enough nurses. So I was asked to talk about my research I did specifically. So I was at Betty R. A. Moore School of Nursing. I conducted research via the barbershop. So I used a couple different models, but really looking at Black men's perspective of becoming nurses, kind of understanding the barriers and what drives men to do so. So I never had a Black male nurse instructor. I think I had my first Black teacher when I was in college. I'm from Merced, Central Valley, right? We all know Merced, Modesto, Fresno. And I didn't meet a Black man who was a nurse until I started working as a nurse. And it was just it's not something that I ever thought of because historically it's a white women's profession. When you look at the statistics, still over 80% of nurses are females. And that's cool. And I always say, whenever I give a presentation about this, I by no means want men to take over nursing at all, because we would not be here if it weren't for the work that my aunties did as nurses and the work that just all the amazing women did at paving the way for this profession, particularly here in Northern California. For you all that don't know, our students and our kind of job pool is not just competing against Sacramento. We're not just competing against California. We're competing against the nation when it comes to registered nursing. We get paid more here, sometimes 3 times as much, but a lot of the times twice as much than anywhere else in the country. This is the gold mine for registered nurses, and everyone knows it. When you go to a national conference, I've been around the country over the last 3 or 4 years, everyone lights up when you say you're from California. Everyone lights up when you say you're from Northern California because they know how sweet of a spot it is for nursing, and that's only because of the nursing union and the work that they've done before us. So that might be a big pull for your students, right? That I think the estimate was $100,000, the average. Registered nursing is pushing that average. At Kaiser Roseville, they're making double that, and it's pretty remarkable. So what did I find? I found that the themes in my research aligned with those pertaining to stigma as nursing being a feminine profession. Using the barbershop was actually a proven intervention for growing diversity in the study, and offering mentorship and role models was really a good opportunity that we could use. And I'm going to show a video. I'm pretty smooth with the Zoom, but we'll see how we do here. Oh, okay, great. I'm going to show this video just so you can get a little context. If it's choppy, I apologize.
So I heard you're getting better and you're going downstairs. I always knew I want to be a pediatric nurse more than anything. Always loved kids, love taking care of kids. When they're crying, I know they're in pain. When they're smiling, I know that they're happy. Kids have really good outcomes. They're extremely resilient. Early on, getting into the hospital, I realized that there wasn't enough African-American men who were nurses. I'd see them being other ancillary service roles when I know that nursing is a viable option for us.
African-American nurses in general are underrepresented. We need people who are representative of the communities that we serve, that can inform what is taught in health profession schools, what is researched, policy development, and resource allocations.
Barbershops are a hub of cultural influence. A lot of conversations and dialogue that takes place has a lot of impact on the way people see the world.
There's so many different walks of life that come through those doors. Sometimes it's you're like a counselor to some, and sometimes you might need counsel from them, and sometimes you might just be excited about talking about things that's going on with your life.
So I decided to set out and do my research, conduct interviews at some of the barbershops here in Sacramento, and try to understand the perception that men had about the profession. A lot of the things that Sacramento really needs.
Carter's work is really around how do we get young Black men to consider nursing as a career option. We need to be planting that idea earlier. We need to be mitigating this idea that nursing is only for women. And the sooner we get that message out, I think the more impact it has on the pipeline.
The aha moment for me was just how engaged the community was in nursing. So I hope that moving forward, we're able to implement different projects in churches, barbershops, and the schools to try to increase the amount of African-American men in the profession.
All right. So that was the video. So that's a little context, right? So that's research. And then we talk about the opportunity, right? So what current opportunities or initiatives are we doing? Let me just describe a few here. Let me jump back to this. I'm running late on my time. Here we go. So putting it into action, right? Research is only as good as the implementation. So getting into the schools, getting into, the community and doing the work. Do not read this because we don't have the time, but ultimately we're going to be we will be bringing a mini nurse pipeline program that's coming through National Black Nurses. So Capital City Black Nurses was one of 10 chapters chosen nationally, the only in the state of California on the West Coast that will be implementing a mini nurse academy aimed at grades 3 through 6 for semesters at a time, kind of pipeline work. So that'll be coming down the pike. I had other videos to show, but for the sake of time, I will save you all. But as far as initiatives, just from a community stance, community focused standpoint, healthcare is changing. We are not going to be able to take care of everyone in the hospital. That's just what is happening. And the trends that I'm seeing, the trends that are working when it comes to insurance and billing, is we're taking care of people in the community, we're taking care of people at home, and we're doing better at doing that. So, or getting better at doing that, excuse me. So training our our up and coming pool of healthcare professionals to think more community faced. And like I said, yes, I worked in a hospital, but some of the most impactful people in community health, public health, have never worked in a hospital. You know, that's just one avenue for us to do so. Some other initiatives that we've had at Capital City Black Nurses, and this is my little pitch. I have 2-3 minutes, but so we've partnered with the Hispanic Nursing Association, doing a Breaking Down the Barriers program that was really awesome. Working on that pipeline, mentoring, providing a professional development, resume building, all of those things that you all know are the true success, the way that students can have success. We did a barbershop actual program, national program that was really informative, really great. Last week, we just did a California Nurse Summit that I organized. We had all the chapters throughout California. We had Congresswoman Lauren Underwood from Chicago, Illinois, who is a Black registered nurse on the US Congress. She gave opening remarks. We had Dr. Linda Burns Bolton. We had Dr. Sue Hassmiller, both sit on the Johnson & Johnson Health Equity Committee at the White House. They were there. And that's just the idea and the capacity that we have as nurses to be innovative. We are forced to be innovative at our core every single day at work, whether it be the equipment doesn't work right, whether it be my patient is declining and I have to think quickly and critically think, or whether it is the doctor's not answering and what do I do? I think it is in our core to be compassionate first and to be problem solvers second and always. And, you know, as leaders, and what I've learned through, you know, my degrees and all that garbage behind my name is that we have a platform to do so. And my voice has been amplified by becoming a registered nurse. Our communities, in my own opinion, will become healthier and lifted up by the more registered nurses that we can get out there. So if you have the capacity to grow your program, if you have the capacity to let more students in, which I know is really difficult to do and easy for me to say, I know nothing about that side of it, but please do. We are giving $50 extra an hour 3 months ago, on top of people already making an exorbitant amount of money because we couldn't find people to come and work. We have a huge job shortage, right? The students that are coming out now are coming out at a perfect time. Everyone is hiring. Everyone needs nurses. I mean, Kaiser did a new grad program. Kaiser hadn't did a new grad program in years. So remind your students that as hard and as difficult as this last couple of years has been for them to navigate, it is a shiny time for them to come out. I know that people are getting offered jobs in school, which was not the case when I was there. And, you know, steer them to places and resources like Capital City Black Nurses. We are open to everybody. It's not selective for any group, or other, you know, organizations and professional development groups. We're here to help. We have a scholarship every year. We don't get enough people that apply. I'm just going to be quite frank. We need you all to steer people to us, and we can help, you know, steward them into the profession. So with that, I'll leave a couple questions. I know I talk fast. I'm really excited about it. Oh, I just do want to share this since it's kind of important. My contact information, just in case if anyone wanted to get in reach with me. I'm on LinkedIn a good amount if you wanted to find me there. And I put my cell phone there. I text way too much. My wife hates it, but I'm always busy, always networking. So feel free to text me if you liked anything that you heard. If you have a student that, you know, could use some resource, our website's there as well, my personal email, and then my LinkedIn. You can keep up with me and everything that we're doing at Capital City.
Carter, we are so excited to have you today. I would love to open it up for a few questions before our panel starts. Just if you've got anything in the comments, if you want to, you know, reflect on what you've heard. Carter, your passion, your commitment to your patients, to your fellow colleagues, to supporting diverse students in our community is just amazing. You have that passion and your service, working the frontline COVID unit. I mean, that is very much part of that. So I really am grateful that you were here to be able to share your leadership in our community, and also your summit last weekend was awesome. Great representation. I was able to attend for a part of it, and we need to reach out and support Capital Black Nurses Association, and really, how can we help our students in our pipeline? So
Thank you for that, Julie. And there's one piece that I want to acknowledge is I shouldn't be here. Statistically, when I was going through the junior college, I had to take the biology twice. When I got to the statistics, I had to take it twice. When I went to apply for nursing school, my GPA was not great. So statistically, when you're looking at these students coming through, they're more than just what you see on the paper. I shouldn't be here. I beat the odds of that, and I had to chart a hard path and look at everything that's happened. So when the students come into your office, when they're looking to you for counselors, see them for more than just that GPA. There's a lot of really holistic views that we should be taking of people and these students coming through, that they could make the bigger change than I can, that's for sure.
Absolutely, and making that connection. I did have one question in the chat. If you could share a little more about the scholarship, please.
Sure. So every year, well, the last couple of years, every September, we have a scholarship event or gala. We got canceled the last 2 years because of COVID, but we already had the deposit down. So we had a big event planned at the Regency Hotel downtown, right next to the downtown, the Kings Arena. We will be having it again this September. There are opportunities to sponsor. Make sure that all of your students apply. Doesn't matter who they are, have nursing students apply. We have 2 awards, one for kind of a doctorally prepared or masterly prepared students doing thesis or community work. And then we have one that's open to LVNs, AA, BSN, everybody. There's another scholarship there. And actually between all of us, we've doubled those scholarships twice every year. So we're on a really great trajectory with that. And your support helps with all that.
Thank you so much, Carter. We really appreciate the information, and I can send out more. No scholarship postings at the moment, but when they come out, we do distribute them, and
yes,
can make sure the colleges are connected. Thank you again. Have a good shift tonight. I know you're going.
Yeah.
So,
thank you, Julie. You're amazing. Just Julie's awesome. Before I leave.
Thank you. That's very kind. And with that, I'm gonna toss it back to Renee to bring our panel. And thank you very much.
Yes, thank you. I really appreciated that shout out to inform, counseling services as well about the opportunities for, keeping the doors wide open to different occupational opportunities for counselors, both in K through 12 and in community college and higher education. What a great point that is. Well, it's my privilege to introduce to you the panel that is going to be answering some questions. We have some questions to start with, but there will be an opportunity also for audience questions. We have Sophia Andrade, Workforce Development Program Manager with Dignity Health Common Spirit. We also have Rachel Wyatt, Chief Nurse Executive with Kaiser Permanente. I believe we have Brenda Shipp, Chief Operating Officer with WellSpace Health. And we have Lennon Svensson, Public Health Division Manager, Director of Nursing with Sacramento County Department of Public Health. Jacqueline Turner, Director of Education and Regulatory Affairs, Covenant Care Privacy Officer, Covenant Care Resource Center. And Lyndon Holing, Manager, Leadership Recruitment and Diversity Services with UC Davis Health. We have a Lennon and a Lyndon, so I'm going to try to pronounce clearly when I'm taking questions or hosting the questions for the panel. So thank you all so much for being here. And we're going to start off with our first question is to ask you to provide a brief overview of your organization, the background of your workforce, as in the number of employees in nursing and allied health careers, or a general number, and the kinds of skills and educational attainment levels that you're looking for when you're doing hiring. And I will start with Sophia.
Hi, everybody. Good afternoon. Thank you so much for having me today. My name is Sophia Andrade. I am the Program Manager for Workforce Development here at Common Spirit Health. And my position sits under talent acquisition. So in workforce development, we focus on pipeline programs and bringing people into the organization. So Common Spirit Health is formed by the merger of Dignity Health and Catholic Health Initiatives. So in California, we represent the Dignity Health hospitals, but we are a national health system with presence across 21 states. And we have a little over 150,000 employees spread across about 140 hospitals across the country. So relatively large organization. I think the question of what skill sets and educational backgrounds we're looking for. As vague as it is, I think the answer is all of them from all ends of the spectrum. As you all know, healthcare and health systems employ a diversity of folks from different backgrounds in the allied health space, to nursing, obviously physicians, and you have your environmental service folks. And so there's I've heard it referred to as a small city at one point. So there's a variety of jobs that happen between them. So I think those were the mending questions. Did I miss anything?
You did great. And I know that's sort of a big question, and we'll get into more detailed questions later. So Rachel, I'll ask you the same question. If you could provide a brief overview of your organization, a background on your workforce, general number of employees, skill levels, and educational attainment you're looking for.
Sure, thanks. Welcome everybody. So I'm actually at South Sacramento Kaiser Permanente. We are one of 21 hospitals within the Northern California region for Kaiser. So when I talk a lot about our workforce development planning, it's both local and regionally, because we do get to spread that wealth amongst the 21 facilities. We are 241 licensed bed level 2 trauma center. It's been a very busy last 2 years, much like what Carter was talking about. We have about 5,000 employees. About 1,300 of those are registered nurses. That has certainly grown over this last year. Looking at hiring, it's really close to what Sophia said. There's not many restrictions, and there's a lot of applicants, a lot of really well-prepared nurses out there. We try to balance a skill set. So there's a balance of hiring those new grad nurses who come in plenty, and where we need the skill set right now. And what we've seen over this last year has been those specialty areas such as critical care, where we really needed nurses. So we're certainly open to hiring anyone, but timing does play a factor.
Thank you so much. Lennon, I'll ask you the same question. If you can give us an overview of your organization, background on your workforce, and what you're looking for in terms of position, skills, and educational attainment.
Are you speaking to me?
Yes, Lennon. Am I saying it right?
It's Lynn Ann, so that could differentiate us.
Okay, that will help me. Thank you.
Yeah. Okay, perfect. Well, thank you. Happy to be here. And I'm from Sacramento County Public Health. We work under the County of Sacramento umbrella. And my role there, as you had stated, is the Director of Nursing and Division Manager. I oversee most of our programs. And we have, as you are or may not be aware, we have a number of prevention programs that we have under our umbrella, such as tobacco education, obesity prevention, our nurse family partnership, chest clinic, sexual health clinic, sexual health unit. We have emergency preparedness and epidemiology and vital records. And those are just naming a few. There's so much more. So a lot of prevention programs, and we are also knee deep in the COVID response. We have been for almost 2 years now, and it has not always been the most supportive of us. I will say community support, just due to the fact of some of the mandates and other things that we have to help to put out there, and some of the recommendations that are provided. But it has been something that has really provided passion to a lot of our workforce, and has, I will be quite frank, burnt out other portions of the workforce. So that's one of our challenges right now that we're having, is keeping people engaged and excited about their jobs, given this long response, because not only are we doing COVID response, but we're also still running all of our programs. So it's a lot. We have over 200 employees in public health. In my chain directly, I have around 200, and those are all permanent positions. And we have anywhere from senior office assistants all the way to nurse managers. Some of the positions I would like to highlight for opportunities that we have are our public health nursing positions, which we do accept new grads in those positions. We have some registered nurse positions right now for our COVID response. We have some medical assistant positions that we're recruiting for our COVID response. And we have a number of other positions that are available too. One thing that has been a little challenging is getting nurse managers that are adept at have experience in nursing, but are also skilled administrators. And so that's an area where I'm really trying to work on recruitment and retention in our organization. So again, we love new graduates. We love nurses with experience as well. We all work together to provide those prevention programs for our community.
Thank you. Thanks for providing to a very candid, honest assessment of what you've been seeing from your perspective. Jacqueline, can you tell us about your organization, background on your workforce, and what you're looking for in terms of occupation, skills, and educational levels?
Yes, absolutely. And I would have my camera on, but unfortunately, I think I need a Zoom upgrade and it's not detected. So you're going to have to just listen to the voice for now. Covenant Care is a company I work for. We were founded in 1994 by healthcare workers. We currently employ over 8,000 healthcare professionals within our facilities, and we have 30 post-acute hospitals, 3 of them providing subacute care in California. So we're a pretty big provider, in the healthcare front. I've been a nurse for 29 years and worked for Covenant Care for 16 of it. Certainly have seen the challenges that have come about by this pandemic. Never seen before challenges. So I'm glad to be here and partner with everyone on this call. We hire middle skill level individuals as our frontline caregivers. So we have registered nurses, LVNs, CNAs, NAs, and therapists, PTOT and ST. We do have our own rehabilitation company. It is Affirma Healthcare. We also provide home health care through Focus Health and Elevate Home Health, and those are also providers under our parent company. About half of our facilities are located in Northern California and Central Valley. I guess the other skill sets that we hire for, the higher skill sets are our leadership position, and the speaker before me had mentioned where we're seeing a need for higher skilled leadership staff. We've seen a lot of turnover in those areas. We hire administrators in each of our hospitals, directors of nursing, directors of staff development. We have new requirements to maintain specialized infection preventionists in each facility, and that came about, during this pandemic. But we also hire regional directors, and we certainly have a need for those higher skill sets as well.
Thank you, Jacqueline. And Lyndon, I'll have the same question to you. If you could tell us about what's happening at UC Davis and what you're hiring for, occupations, skill level and educational attainment, and everything seems to be kind of the answer here, but if there's any additional you can add.
Yeah, I'll save you time, everything, just like the other speakers. Again, I'm Lyndon. I am the manager of our leadership recruitment and diversity services office. And our team actually supports both the Davis campus and the health campus, but we'll focus on our health positions today. Similar to another panel member, we often use that same metaphor about, being a small city. And so really any type of position you could anticipate that we would need to run a hospital, a school of medicine, a school of nursing, we have. Obviously, we have a robust nursing program. We're a magnet designated institution. We have per diem roles. We have some LPN positions, nurse managers, nurse supervisors, really across the gamut. We have a lot of work in our children's health space in particular. And so always working towards finding, the best and brightest talent that we have, both in the nursing space and then for our other positions within the hospital. We have about somewhere between 13 and 15,000 staff members. Primarily those are at the medical center, but we also have clinics, out in the region. Vacancies tend to ebb and flow, but we've certainly seen an uptick with COVID around all of our positions. And UC Davis Health is growing and expanding quite a bit. And so we're anticipating our needs to continue to rise as we build new facilities, new bed towers. We need nurses, we need frontline workers, medical assistants, really working to staff up to ensure that we're providing that world-class support to our patients.
Thank you. And I'll ask a little bit more specificity here. I'll start with Lyndon. Are there any specific challenges you're having for specific open positions or any particular skill gaps or credential gaps that you want to highlight here for the training partners on the call, which a lot of them include community college, but also we have K through 12 partners here as well as some higher education?
Yeah, that's a big question that's hard to answer. It's interesting, many of our roles are still very competitive. I think I'm sure everyone else on this call will echo the same thing, that we're all competing for that nursing talent. At the leadership level, looking for those nurse managers, certainly finding individuals that have that technical expertise, but also demonstrate, a strong ability to lead teams that are under a lot of pressure, that are very stressed out by COVID. Certainly finding those folks that can bring all of that to the table at the leadership level is really important. And then certainly the more hands-on experience that applicants can bring to the table, the better. When we do our job talks out in the community, not for just nursing roles, but really for all of our healthcare positions, we talk a lot about, finding ways to get volunteer experience, to get on-site experience, some type of hospital experience can go a long way towards really standing out as a candidate when you're applying for these roles. So the more opportunities that you have to take advantage of those, the better, whether it's what you're doing during the summer or on the weekends. The healthcare field is competitive, and anything you can do to get that competitive edge, we encourage you to take that on. So that's a very small answer to a big question, but certainly when we're looking at how competitive our talent pools are, anything you can do to stand out, the better. And then the other piece that I just want to call out very specifically is that UC Davis Health is located in the Oak Park community, and we very much have focused on supporting underrepresented communities, working with diverse patients. So the more that you can do to work in that urban healthcare space, the better. So as you're seeking out opportunities, if you're looking at UC Davis Health, that does go a long way in an interview.
Thanks. Thank you. Jacqueline, if you could provide us any additional specificity on what you're looking for in terms of hiring or skill gaps for open positions for your organization.
We have lots of openings within our organization, a lot of frontline caregiver openings. We literally saw a halt to incoming applications throughout the pandemic, very noticeable halt. So there were a lot of reasons for why that occurred, but one of them being, the testing centers had closed down for nurses and CNAs that were fresh out of school. And so we believe that was part of what had an impact on us. Currently, I think we're struggling with what other members of the industry are struggling with is some people are just choosing not to be in healthcare anymore. So our workforce base that has been long-term, some of them are just deciding this isn't for them anymore. The pressures of the pandemic, the workload increases that transpired, the health and safety risks to themselves and to their loved ones at home. Some of them just threw in the towel. So we had positions that normally didn't turn over, our higher level skilled positions, normally didn't turn over as frequently. Suddenly, all those were turning over, and we had needs in all of our facilities. So that created something that we had not dealt with before. And because those closures of the testing centers, it basically stopped the pool of replacement workers that we would normally rely on, to fill our open positions. We are historically in post-acute care. We are a training ground for the acute care hospital staff. I mean, a lot of our workers that come in, they don't stay long-term, the frontline workers, because a lot of their goal is to get into acute care. So now the acute care is taking these new grads and we're especially seeing the effects. We compete for the same exact staff that the acute care hospitals compete for. And certainly we can't be as competitive from a wage aspect for obvious reasons. Our reimbursement levels aren't the same. So that particularly has hit us hard. So we do have open positions in just about every area. And we're seeing unprecedented workforce shortages than we've ever seen before. And I think there's a lot of factors that have played in as a result of the pandemic. And I think it's hurting us all. Nobody's immune to it right now.
Thank you. Let me ask Lynn Ann, what are the opportunities for new graduates in public health for any and all specialties or any positions? I know you talked about the higher level positions, but what are the opportunities for new graduates?
Yeah, so the opportunities for new graduates are for public health nursing. We have positions, so that requires a baccalaureate degree. And within that, we have current openings in our Hearts for Kids program, which is a home visitation program for foster children. We also have an opening in our communicable disease program. And there are other, openings within, the public health as well, but those are the ones that we're really trying to recruit hard for right now. Some of the challenges I wanted to just speak to that's a little different is we are trying to find individuals that represent the communities, the diverse communities that we're working with. And that's a challenge for us. So trying to find individuals of color that are, nurses that can really relate and work within communities. And in addition to that, another challenge we have is people really understanding what public health is, and that's an option coming out of school. I think a lot of times they're told, even if they're interested in community health, oh, well, you need to get your acute care experience first. Well, that's just not the case. I'm here to debunk that myth. If people are interested in public health, we are happy to take them out of school. They will develop those assessment skills that are needed, and it doesn't require that year of acute care experience on med-surg or otherwise to make a good public health nurse. So yeah, we're recruiting for RNs, public health nurses, and we will take new grads, especially those that have great communication skills and those that really have a passion for serving the community. And we don't have the best wages either, but what we do have are great benefits, and we have the opportunity to mostly have holidays off and weekends off and those types of things, which are great for people that are trying to balance that, work-life balance, or have that work-life balance in their lives.
Thank you very much. Rachel, can you tell us what is happening with Kaiser, and what are the opportunities for new graduates in all specialties, and any particular challenges in recruiting or skill gaps that you would like to highlight?
Sure. We're really proud that we began, again, Carter mentioned it, a nurse residency program this year that we were able to start up during the pandemic. So we are actually on to cohort 2. So again, as a region with the 21 facilities, we started with the cohort 1 back in the summer. In May was when they started, and we started with 100 new graduate nurses spread across the 21 facilities. And here at my facility, we did receive 10 new grads. They're interviewed from a regional perspective, and that was really strategic and innovative for us. Our managers, who were mostly doing patient care throughout many of these surges, time to sit and interview candidates was very limited. So we used some of our regional resources to do virtual mass interviews to make sure we can get through the 1,000 applicants that came through cohort 1, another 1,000 applicants through cohort 2, and happy to say that we increased our nurse resident capacity to 200 students or new nurse graduates in this fall. And my hospital received 15 of them, and they're going to actually be starting next week. So that's very exciting. And we'll be doing at least 2 cohorts a year moving forward. That helps the new graduate nurses. We also began a transition in practice program for our nurses who are already here, who want to upskill into those specialty areas, which are the areas that we have challenges hiring into. So perioperative is really one of those areas that's very difficult to hire into. And labor and delivery has been another area that's very difficult. And that will then open up, more positions that we can bring in new graduates into.
Wonderful. Thank you for sharing that information. Sophia, for Common Spirit Dignity, if you could share with us what are the opportunities for new graduates in all specialties and any particular challenges or skill sets you're looking for?
Sure. As you can imagine, there's probably a lot of overlap with the panelists. So very similarly, nursing is obviously a huge part of our workforce. And we are also kicking off a nurse residency program across the organization. So by background too, my position sits at the national level. So I work with folks across the country. And so nationally, we're going to be kicking off a nurse residency program next year that will host several pilot sites. And California will have a couple of those. I don't have the locations with me off the top of my head, but we will be kicking that off next year. In addition, I think some of the highly desired positions that I see from our leaders across the organization are laboratory technicians, something that has been in high demand. Obviously, medical assistants, certified nursing assistants, and respiratory therapists. And one thing that I had heard specifically from our Sacramento talent acquisition team is the rising need for behavioral clinicians as well. I think that the past year has been very difficult for a lot of people, and a lot of folks are rightly seeking out services for their mental health. And the workforce that we have on that end is not, we were not prepared for this wave of folks seeking out mental health care. And so that's a rising need that we've been seeing, I think in the last several years, but definitely impacted by the pandemic as well. I think some of the challenges that we've been facing, as a lot of my colleagues have alluded to, is just a very highly competitive market. I think everybody's kind of competing for the same folks. There's high turnover in some of these positions, partly due to the pandemic and partly due to burnout that folks have been experiencing, especially on the front line. And our end, one thing that our Common Spirit has rolled out to address this burnout was a program that's called Care for Caregivers, in which we took a moment to look at the of our workforce and really be able to support the emotional and psychological needs that folks were having in this very difficult time. Being on the front lines of a pandemic obviously takes a toll on a person's psyche, soul, their whole person, their whole being. So that was a program that we rolled out to kind of address one of the challenges that we had internally.
Thank you. That's a great segue into our next question, which is how can the folks on this call best prepare students and those going into training for medical careers for the demands of the workforce in healthcare during the pandemic and with all that we've seen. And Lynn-Ann, I'll ask you first, what are some ways that we can better prepare students and individuals going into training?
Yeah, I really think that it's important to give as much as possible. If you're working with BSN students, giving them great opportunities for placement so that they truly understand what public health nursing is and can get that experience of working and shadowing a public health nurse. The other thing that I think is really important is the importance of teaching about, obviously cultural competence, cultural humility is super important, and understanding how to work collaboratively with other organizations and beyond what your current scope is to sort of get the big picture of what's happening in the community, as well as, talking about how to take care of yourself and keeping yourself ready for all the opportunities that are in front of you by making sure to balance that, your work and your home life so that there isn't burnout or that burnout is delayed. And, I feel like a lot of new grads come in sort of charging, they want to just get it all done and learn as much as they can. And they're willing to take every shift and, and it's our job to nurture and to take care of them and to really help them to understand that this is a long game, and to take care of themselves.
Thank you. Jacqueline, can you let us know your thoughts on preparing students for the demands of healthcare, especially by virtue of what we've seen during the pandemic?
Yeah, I can speak certainly to our post-acute setting. We open our facilities to be training sites, clinical sites for community colleges to rotate through so that those students can get an understanding of what we do in our setting. So in my opinion, increasing their exposure to real life job situations and employer expectations would be really important. So any opportunities to maybe extend those rotations through, maybe increase the demands even on those students. I know a lot of the times when the students roll through, they'll get maybe assigned 1 or 2 patients throughout the entire rotation, and it never really increases. And I get the need to train and acclimate the students and safely do it within their skill sets, but I don't think they get a real good impression as to what the job demands are going to entail once they hit that workforce. So we address that in orientation with our new staff by ramping up their assignments during orientation. So they'll start out 1 week with maybe, just observing and shadowing. And the next week, maybe they'll take those couple patients or what have you, but then they ramp up to actual full-fledged assignments where they are running the show and running the unit and handling business. So they really get a good idea of the stress load, a good idea of the job demands, and a good idea of the workload. And I think that gives people an accurate picture, especially if you're a hands-on learner. And you need to kind of walk through and apply your skills in the classroom in a real life environment. I think that's a good way to maybe prepare these students a little bit better, so it's not so shocking.
Thank you, Jacqueline. Lyndon, what are your thoughts on how to best prepare graduates for the demands of the field, especially how it has changed?
Yeah, absolutely. Again, I would echo everything everyone else has shared. In particular, felt like Leanne, you were taking the words out of my mouth. So I really appreciate that perspective. And I'll just continue to call out the diversity, equity, and inclusion component of this work, and really understanding that this is becoming more and more part of the identity of healthcare organizations, is really helping our practitioners, our healthcare professionals understand the role that they play in not only providing healthcare, but really addressing health disparities and this recognition that there are disparate outcomes for different communities, and that we have an affirmative responsibility to address those health disparities and those disparate health outcomes that exist in our communities. And we expect our healthcare professionals to be aware of that, to understand that that is part of the responsibility of their jobs and part of what they're opting into when they choose to work at UC Davis Health. And so the more that we can do to talk about what it means to provide equitable healthcare, to meet somebody where they are, and to be, culturally equipped to provide somebody with the type of support that they need, is hugely important. And then the other piece that I want to call out too is certainly, cultural humility and this understanding that, walking into our education and walking into these conversations, understanding that we all have something to learn, and being humble enough and open enough to pursue that and be passionate about that. So that would be the piece that I would really want to highlight as part of our curriculum and part of how we're preparing our students to be successful in the healthcare space.
Thank you. I'm going to go slightly off book for a second and ask you, October is National Disability Employment Month, and we've heard talk about DI a little bit on this call. Are there any initiatives that UC Davis has, or any thoughts about expanding the employability and access to folks with disabilities?
Yeah, absolutely. There's a lot of things I think we could talk about. I said my colleague Spencer is on this call. I actually had Spencer and some folks from his team come out and talk to our recruiters a couple of years ago. And for me, that's very much the way in which we talk about operationalizing this commitment to supporting different diverse communities, folks with disabilities, is not just pontificating about how it's part of our mission and vision, but really when the rubber hits the road, having these conversations about best practices, about real life scenarios, about what to do if this happens, how can we be inclusive if that happens? So really, really just partnering and actually having meaningful, tangible conversations about how we can be equitable. And then broadly, there's a lot of work that we're doing as an organization, and it really starts at the top. And that's a point of pride for me. I'll highlight our chief nursing officer, Toby Marsh, for example, at UC Davis Health, has really bought into and championed equity in healthcare and inclusiveness in healthcare. And that's very much part of just his persona and sort of how he runs the nursing program. But he's turning that into action with diversity, equity, and inclusion committees, trying to identify metrics to look at our workforce and see where we lack representation, and it's more than just race and ethnicity and gender identity. We're looking at disability, we're looking at veterans. So really having that holistic perspective about what it means to walk the walk. So the partnership, working with departments, like Department of Rehabilitation, our community-based organizations, really putting in the time in a meaningful way so we can make meaningful changes. And again, it goes back to that humility. We have to recognize that there's a lot that we can do better to be the organization that we aspire to be.
Thank you. I'm going to go back on book for a minute and ask Sophia the question about whether or not what are different ways that we can inform graduates about the demands of the pandemic. And then we'll follow up with a diversity and pipeline question to everyone subsequently.
Oh, Lynn Ann's hand up though. Did you want to make a comment on that last topic before I round this out?
Yeah, I just wanted to say that if people are looking for an opportunity for individuals that are getting jobs that might have some disabilities, physical disabilities specifically, a lot of the jobs within public health are case management telephonic jobs. And so that is a great opportunity for people that may not, be able to work on their feet in the hospital, but they can work by a computer and do case management and really put their skills to good use. So I just wanted to add that.
Thank you. Thanks, Sophia, my co-host. Great job.
No problem. I think to not repeat, I guess, what's already been said, one thing I guess that I have heard feedback on in terms of the skill sets for new graduates that has introduced, I think, a need on our end for us to step in and kind of provide additional training is just, I guess, the readiness specifically for nursing to transition from like the school and the theoretical aspects into the application part of things. And so one thing specifically is that I've heard from our leadership is just the amount of patients that folks have to deal with. So in school, I think people are being trained kind of a one-on-one, maybe a little bit smaller of a patient set. Transition into your first nursing job, your patient sets are a lot higher. And so that's something that folks have had a difficulty in transitioning for and has introduced the need for our nursing residency program, filling the need for the types of skill sets that we see the gap in. Other than that, I think things that I've heard a lot are around the soft skills, being agile, which is something that all of us need in whatever, I guess, whatever work that you end up choosing to do. But specifically in the pandemic, I think agility has been something that has been critical because circumstances are always changing. And then obviously, have to take care of yourself. Self-care has been important to avoid burnout. Being able to transition quickly. And then I would just say for us specifically is the aspect of human kindness. I think keeping that in mind in difficult times and remembering that we're all human and connecting with that side of healthcare delivery.
Thank you. I think, Rachel, I haven't asked you this question yet about your thoughts on how we can best prepare graduates for the increasing demands.
Sure, thanks. I think new graduates need to be prepared to be courageous when they're coming in. They're coming into a totally different environment than any other nurse has worked before, and they're coming in as a new grad. We were all new grads and very stressed out and nervous for the first 6 months or a year of our life. And now we've had a pandemic on top of that. They should be asking questions to make sure they're working in a safe environment. They need to feel safe and they need to get involved. You know, there's a lot of different work going on locally. We've started several different equity, inclusion, and diversity support groups for our staff, looking at really how we can provide better culturally competent care to our patients. And that's all driven from the staff. So I think new grads, to be successful, it is those soft skills, but you've got to get involved in the work. It's not just the technical aspect of nursing anymore, because the pandemic also opened up many doors to innovation using AI and robots to do simple repetitive tasks. So it does come back to the ability to really care for our patients and back to the purpose and meaning of nursing. And I think they need to get prepared to be involved.
Thank you. I'm going to, I have a question that was sent to me directly in the chat, and I'm going to ask Tony, are you comfortable unmuting and asking the question directly yourself to the panel?
Yes, absolutely. Thank you. I was listening to the various speakers, and I heard a lot about self-care and mental health, particularly for the healthcare providers and the nurses and others that you have working in the facilities. And so when you're looking at the need for mental health workers, what classification or what type of mental health worker are you looking for specifically? Counselors, chemical dependency, social workers? What is the specific type of training you're looking for in an individual, and what type of role might they go into?
Perfect. Should I call on from the panel? Lynn Ann, do you want to start, or do you have an answer to that and we can open up?
Yeah, well, within public health, we don't have a lot of behavioral health workers. We do have one in our maternal child adolescent health program, and the classification is a LCSW for that. So that would be it within public health. And I know that it is difficult within our Department of Health Services at the county to get those licensed credentialed LCSWs that sometimes are obviously needed for billing purposes and things like that, or Medi-Cal reimbursement. So I think that's where we're having some difficulties recruiting in our department.
Thank you. Any of our other hospital partners or Covenant Care?
Yeah, I think
Go
ahead.
I was just going to say our positions are limited in that category, but we do hire social services directors in every hospital. We do prefer them to have a higher skill set. There's certainly increased complexities around discharge planning. So it's really hard if we hire somebody who doesn't have discharge planning experience, or doesn't have those proper skill sets to place our patients who are increasingly sick and have increasingly medically complex needs back out into the community. So we definitely need the higher skill set for that position, but we typically only have one of those in each of our hospitals. But it's a very important position, and it's one that we would prefer to have somebody who's skilled and who's experienced.
And for Kaiser, we don't have a specific behavioral health unit here at the hospital. We did just start hiring a new role into our emergency department, and it's a licensed psychiatric technician. Within this last month, we just started hiring those roles. So we're really trialing it out to see how it goes in conjunction with our nurses. We have a behavioral psychologist on staff at least 16 hours of the day in the ED, because we have many behavioral health holds.
And then I'll just add from Dignity/Common Spirit perspective, it runs the gamut, but I've seen, and I don't have the current list in front of me in terms of our openings, but I've seen the majority of folks requiring a licensed clinical social worker degree.
Yeah, same with Davis. I'm not that in the weeds to be able to give you an answer confidently, certainly, but just in perusing our job board right now, a lot of them look like they require master's degrees.
Thank you. Thanks for the question, Tony. Next question that we have for you, is there any specific training that your organization is providing to address the workforce shortage needs, and any specific pipeline projects you're working with especially to support a diverse pipeline. And Raquel, I'll start with you.
Sorry, do you mean Rachel?
Yes, sorry.
Okay.
I have a cousin, Raquel. All day I've been like, I want to call you Raquel, and I know it's Rachel, so I apologize.
I think in terms of pipeline, we are working on one of our national strategies is to increase employment by improving access to quality jobs. So we're partnering with some of the community partners to open up more positions and really increase access to high quality jobs. That's really where it starts. And then as far as training, we're actually introducing different layers into the interview process. So very one-dimensional resume that you review to look at a candidate, but we're looking at candidates pre-screening, both video and audio, their screening interviews, and then providing that to the hiring manager. It really gives a bigger picture view of the candidate. We're also doing a lot of training for all of our leaders and our frontline staff, really around equity, inclusion, and diversity, and really focusing on, you know, the unconscious bias that we have and how we can mitigate that.
Thank you, and I'm sorry
okay.
for calling you Raquel. Lyndon, I know you partially answered this question already with some of your diversity programs. Anything you can add about specific training UC Davis is doing, or any pipeline projects you're additionally that you're doing?
Yeah, I mean, this is kind of my bread and butter, so I could go on and on about this, but I'll keep it relatively brief. Certainly, outreach in particular is a huge priority with our institution, and so we're doing a lot of work with our community-based organizations, with the Employment Development Department, you know, other units that are looking to put folks to work. Also a member of the Los Rios Community College Health Pathways group, and jump in as often as I can to really focus in on that community college pipeline piece specifically. When we do pipelining work, when we do our outreach, we really are focusing on, first and foremost, demystifying the application process. We have found for many individuals that the hardest barrier is just wrapping their head around our process, translating and understanding the types of roles that we have. You know, many of you are working with your students to help them map out the work that they're doing, the career pathways for them, and then what that functionally looks like on a job board when it's time to find a position. You know, every hospital is a little different in terms of the titles we have, the roles that we have, where the work lives. And so again, it's all meant to be very much focused on transparency, about practical engagement, about meeting people where they are to ensure that they can put their best foot forward when they apply for roles. I also wanted to highlight that UC Davis Health is pursuing recognition as an anchor institution, and that's all about putting people to work in the local community, and then also focus on supplier diversity. And so there's some very specific and targeted metrics and strategies that we have in that area that are all about, again, workforce development. And the other piece that I'll highlight is that we're doing a lot of work internally, and that's just as important. So we can do all the outreach in the world and attract talent, get them all geared up to apply. But if we're not also making that value proposition to our hiring managers, to our search committees, if we're not incorporating best practices into our interview process and our screening, then we're only doing half of the work. And so as much energy as the public sees about our outreach, we're doing just as much to help make that value proposition around diversity, in particular in our workforce. And then the last piece that I'll mention is that we are very intentionally focused on diversity at the leadership level. That is why we have leadership recruitment and diversity services as a department. We see a lot more diversity reflected in our entry-level roles. And it's important to us to ensure that that diversity persists throughout the organization. And we're making some very explicit efforts in that regard to see diversity at the leadership level.
Thanks, Lyndon. Very comprehensive answer. Appreciate it. Jacqueline, can you tell us about the efforts for Covenant Care that you're doing to diversify the pipeline, any pipeline projects, and any training that you might be doing your organization itself to assist with the healthcare worker shortage?
Well, we are particularly hit very hard at the CNA level. So many of our facilities have applied for NATP programs so that we can teach our own nurse assistants in-house. That, of course, comes with a lot of challenges, as I'm sure the educators on this call would know. But we're trying anything, to get a pipeline of applicants in our facilities. So we have embraced our own nursing assistant training programs at several sites. We do have an upcoming problem in the next couple of days where I believe the American Red Cross is pulling back their testing centers. So they will no longer be testing nurse assistants. So that's going to, I'm not really sure where that's going to play out for us. So kind of leading into the other question on how these colleges can partner with us is, I mean, if there's any availability of being testing sites or testing centers to help us not only test their own students, but ours as well. I mean, it seems to me like we're going to have some problems on the horizon with regards, particularly to nurse assistants, because the American Red Cross has been counted on for years to certify CNAs.
Thank you for highlighting that. That's a big problem. Lynn Ann, can you tell us about the pipeline projects that you're working with to diversify the workforce in public health and any training that any innovative training you might be doing?
Yeah, so one thing I'm really excited about is with some federal dollars, we just created our public health and racial equity unit. And, public health has historically worked on a lot of health and racial equity projects, or it's incorporated within our programs. I mean, that's been going on for decades, but I'm super excited that we have a unit now that is just specifically going to focus on this within public health, starting out with what are we already doing? What is the understanding of our staff as far as a knowledge base, the different levels that people are at? How can we increase proficiency in this area? How can we maximize our state and federal grants to do more health and racial equity work? And so super excited to have that opportunity, and then also continue to work with our wonderful community partners to help provide opportunities for our community-based organizations to have their diverse workforce go into communities and with like promotora models and things like that. So super excited. We've been able to do a lot of that with our COVID response as well, which has been great. We put a lot of the money that we've received back out into the community because we really want to work with our trusted messengers and to help increase the health and racial and health equity within our communities. Something else that I'm super excited about is that we had a Sacramento County Black Midwives Scholarship Program where we're offering up to $25,000 scholarships to train Black or African American students with, that are high school seniors or high school graduates or graduate students to become midwives. And I think that is a really cool thing that our maternal child adolescent health program did to try to, again, have a diverse workforce, healthcare workforce, and really help to relate with within our communities of color to try to level the playing field a little bit as it relates to birth outcomes and things like that. So I think that's exciting. And then I'm also, I've created more contracts with additional schools since I've come on board in Sacramento County. I became the director of nursing in Sacramento County in January. So I've expanded our preceptorship to include many more students. And one thing that they've really been helpful on is the COVID response. And I think it's a great opportunity for them to participate in something that's, that they can see themselves helping to better their community at a direct level. And so that's been super exciting to work with all the students on the COVID response, and also just to get more students coming through our division.
Well, welcome to the job in January, Director of Nursing and Public Health. Thank you for highlighting those innovative programs and for your work there. Sophia, let me ask you, what are you doing with pipeline programs at Dignity Common Spirit, and any training that you're doing in-house?
Yeah, definitely. So a lot of what we've heard already in terms of our internal programming, the nurse residency program that was discussed earlier. We also have internal trainings for medical assistants and certified nursing assistants. And some of our locations in the Midwest, in Des Moines, that has been a model that's been replicated across the organization as well. One thing that I would add in terms of pipeline programs that we do and we try to focus on is partnerships, because a lot of folks, there's a lot of organizations, community organizations, even national organizations that work on this diversity, workforce, and healthcare issue. And so we partner with those as much as possible. And one of the organizations, which I'm sure you all are familiar with Rural Health. I know Kaiser's on the line, and Kaiser's a really big partner of theirs as well, in training, and then on our side of things, hiring the diversity in the workforce and the allied healthcare space that we would like to see. So that's one thing that I just wanted to add.
Thank you. And then the last question that I have for the panel, and then, if there is another question from the audience, please feel free to put it in the chat. There's faculty shortages at the community college level, kind of en masse. Are there any innovative approaches to partnering with the community colleges to fill those gaps? And also, what would a robust partnership with the community colleges look like to meet your goals for pipeline development over the next 5 to 10 years? And Sophia, I'm going to start with you this time.
Sure, I think that's something that, and maybe we're already doing this, maybe I'm just not in this conversation, but something that I would like to see is more conversation with maybe the folks that are precepting or training folks in their clinical hours, giving feedback to our educator partners. Because what I hear a lot of is there's a gap in some of the soft skills that folks are seeing. And so in my view, I feel like that should be a clear pipeline of communication between the two folks. And so maybe that's happening, and I'm not just saying that, but that's something that I could see that we could maybe focus on area improvement. In terms of faculty shortage, and again, I'm not sure if this is already happening, but just something that came to mind. It's not something we do, just something I was thinking of, is maybe focusing on the part of the workforce that's approaching retirement, or maybe wanting to transition out, and bringing them into either, maybe not the faculty space, but kind of transitioning into the teaching space in the later years of their career. Maybe they are transitioning out of patient care and wanting to do a little bit something different in that part of their career. So potentially something that we might be able to pursue.
That's a great idea, Sophia.
Thank you. Rachel, what are your thoughts with partnering with the community colleges on faculty shortages? And then also, what would a robust partnership look like with the community colleges over the next 5 to 10 years?
Yeah, thanks. We do a really great job with our relationships with our academic partners and also other local hospitals, definitely in communication and what's upcoming challenges. Looking at how we can partner better and create a better, robust pipeline together. I think it's a challenge with faculty, even when we have a lot more nurses getting higher advanced degrees and staying at the bedside. They're doing it because of the salary. They would want to pursue other opportunities, but they have to balance their home, their personal lives, and their families. And acute care jobs do pay more than faculty level jobs. So is there an opportunity? And again, there's not discussions, we're doing it right now. These are some of the things I thought of as the question was posed. Is there like a dual employment possibility between working for the hospital and working for a college or university and teaching? And then there being a back end with how do we get more new graduates in. So I think we have to look at things very differently moving forward. We can't do things the same old way, obviously, because it's not working. So definitely something we need to think about.
Thank you. Lynn Ann, your thoughts on helping to bridge the faculty shortage, anything innovative there, as well as what would a robust pipeline project look like with the community colleges?
Yeah, I mean, definitely agree with what the panelists prior to me stated. I also wanted to just offer that if there is the need for guest lecturers or things like that, I think reaching out, and especially within, I know, community health, I'm very passionate about doing that as it and speaking to public health and public health opportunities, whether, including, I've done some guest lecturing at Sac State related to like the whole community involvement process and the public health planning cycle, and other topics like that. So I think, utilizing some of the expertise at our healthcare organizations to provide some of that guest lecturing might be a great way to adjunct some of the capacity and or knowledge base that's found within our various schools. And yeah, I really agree that marketing to those that have been in their positions for a long time and are looking towards that sort of sphere, stepping back from the acute realm and or going part-time because they're retiring from their current field of expertise, it is a great area to focus for recruitment.
Thank you. Jacqueline, I'll ask you the same question. Faculty shortages, and then what would a robust partnership with the community colleges look like?
Well, historically, we have partnered with the community colleges with regards to opening up for clinical rotations. But I think in light of our challenges that we both experience on both sides here with staff, we are required to maintain full-time trainers in our facilities and full-time infection preventionists who are nurses who engage in training. So I could absolutely see a partnership where we would take on classroom training, some of the module training, not just allowing, our patients to be present for a clinical rotation, but maybe actually even supervising the clinical rotation and doing the skills competencies and things of that nature. Certainly we could train modules in your curriculum that are mutually beneficial to us. We can't train you on labor and delivery, but we could train your infection control chapters, or we can train MedPass or things of those natures. So I absolutely could see a partnership evolving that's well structured and well defined, where we could share clinical instructors. We have mutual, we have mutual goals here, and that's to crank out the best clinical healthcare workers that we could possibly, put out into the workforce. And so we want to be a training site for local colleges. But unfortunately, we're not historically the site of choice. We're post-acute care, and a lot of the students want to be in acute care, and they gravitate to those training sites as well. We usually get a rotation that's a couple weeks or what have you. But I can assure you that in many of our facilities, there's no shortage of skill sets that are needed. We care for vet patients and subacute patients and the same clinical complexities that you see on the med-surg units in the hospitals. So we want to be a training site. We have trainers, and I can see us partnering on a deeper level, and not just, giving you our patients, but also giving you our trainers.
Thank you, Jacqueline. Lyndon, same question to you. Any innovative thoughts on helping to solve the faculty shortage with the community colleges and preparing workers for positions you have available? And what would a robust partnership look like to address the hiring needs over the next 5 to 10 years?
Yeah, well, I think that faculty piece, that's a complicated question. I don't know if I'm knowledgeable enough to really answer that, other than saying pay them more, but that's probably not the politically right thing to say. So in terms of the partnership with the community colleges, again, I'm a very, very pragmatic person when it comes to that. And I think there's a lot of work that we can do that's just like this, that's really getting into the weeds about these roles, what is required of these jobs, and then spending the time to just educate our students about how to best position themselves to be successful in pursuing these career pathways. When we do job talks with community college students or other community members, those are the types of probing questions that we want to ask so we can step into that space and be, meaningful and helpful partners for those individuals. We don't want to step into that space as an organization and just pontificate about why it's great to work at UC Davis Health. We want to have, an analytical and functional conversation about what the individuals that we're talking to need to do to be successful. And so I really appreciate spaces like this where we're bringing in these different employers and this industry representation to ask these pointed questions, and continuing to provide that type of partnership and collaboration is important. And then the other piece that I just want to call out is the importance of dedicating resources to these conversations. My colleague, Ali Martinez, is on this call, and she's our diversity and outreach coordinator at UC Davis. And we receive funding to support her work towards this common goal. It's hard because so often this stuff is just happening off the corners of people's desks, or it's 5% of their portfolio. But really, we need to have dedicated, thoughtful individuals working strategically to build these partnerships and pipelines. And so that commitment to this work, needs to manifest itself in resources and people to do the work.
Thank you very much. I do see a more of a comment, I think maybe than a question by Dr. Gould. And so I don't know if you have something you want to voice there. I also want to provide an opportunity if Julie has any additional questions that she wants to bring forward to the panel, or any other audience questions. So if you have something, put a comment in the chat or raise your hand. We'll ask, is it Dr. Grant or Dr. Gould?
It's fine. It's Grant.
Okay, it's Grant. Okay.
And I'd prefer if Julie went first, and then I'd just like to ask the whole panel and the group as a whole if we ever considered doing a joint powers authority, which has been used frequently when organizations of different feathers have to come together and toward a common goal, and they can share the economic burden that presents. But Julie, what were you going to say? And then I'll just ask this group to weigh in on the JPA.
So that is a very interesting, that's a great, I'd like to learn more about that, honestly. And so I think that's something that we could maybe look at as the next steps. And I wanted to highlight one thing, Jacqueline, that you shared with talking about our certified nursing assistants and the gap that is through all of our care delivery systems. And the testing centers through this American Red Cross, they just recently pulled out in that business, like Jacqueline was sharing, and that is going to greatly affect it. We do have a testing center in the Bay Area, but that is a long way for our students to go, and so that's something that could be perhaps an opportunity. Some health systems are not necessarily using CNAs at this time, and I realize that. So it's a skill mix that can occur in different settings. So I thought that was a great point, Jacqueline, that you brought up.
Well, and that Northern California testing center is prepared to get an influx like they've never seen. So there's going to be a backlog of students waiting to test, and that alone is going to discourage people.
Right. And so just highlighting that and seeing if there's other opportunity in the North State where we can try to partner to bring more testing opportunities for students. Our faculty conversations and how those partnerships, those are innovative. I think that it is important. It is definitely part of how we can give the supply of all healthcare workers across all specialties. And so I love the idea that we're just getting some momentum and people are willing to really bring that to the table as well. And I just wanted to open it up for their other questions from the participants and people that are here today, taking the time to come. So, I can just say that we just really appreciate. Renee, was there another wrap up item? Oh, Susan has her hand up. Sorry.
Right.
Hi,
Go ahead.
I wanted to introduce myself. I'm the interim director of nursing at American River College. And probably about 10 years ago, we had a partnership with all of the healthcare agencies in the Sacramento area to educate more nursing students. And what at that time it was Kaiser, Sutter, Dignity Health, and UC Davis each provided a clinical instructor, and we were able to then double our enrollment from 40 students to 80 students. And we did that over several years. We went ahead, the faculty, instead of lecturing or holding a seminar for 40 students, we just held it for 80, which had an impact in terms of space, but not that big of an impact. But again, the nurses then were willing to work as a clinical instructor because they got their hospital salary and their hospital benefits along with their job. So a lot of the nurses that I meet in the clinical settings, I met one yesterday at Kaiser who said, I'd love to teach, but they take such a pay cut to come and work for us as an adjunct that it's a huge sacrifice. And some of them, due to very solid financial decisions, are not able to do that. So, we're in a real dilemma. We've got positions posted at ARC and we can't fill them. It's very difficult, mostly because of the pay discrepancies between the private setting and the colleges. Nursing faculty, we get paid, as a matter of fact, 20% less when we're in the clinical setting than we do when we're in the hospital setting. And so we're really trying to address some of those issues on the community college campus, but we probably need support from our community for us to be able to attract nursing faculty to provide more nurses in the future. It's a real challenge for us. That's all.
And then trying to also think about that pipeline of how we prepare our current workforce to be faculty, whether it be in nursing or medical assisting or farm tech or CNA. There's all of the specialties that I've heard a need, and also our mental behavioral health as well. So, Renee, I just wanted to go ahead.
Grant, did you have a question that you wanted to ask to the panel, or was that addressed?
No, it's really, we hear this around the region that we've got a regional problem and we've got a statewide and a national problem in this. It seems like it's high time that as a region, we bring the stakeholders together and look at what do we need to do as individual groups, but collectively through this regionalization to potentially put something in play where all the colleges are involved and all the healthcare providers are involved, where we can take all the resources that come from all these wonderful groups and bring it together in one place and potentially have, as I mentioned in my comments in chat, I think it's high time for credit for prior learning. We really need to take a strong look at that so that we can infuse more people into the pipeline. I'm thinking about some of my students who have some foundational work that could bridge really nicely into the nursing shortage if that pipeline was clarified. But I think we could be a great place in this region for some very innovative and creative ways to address the faculty issue, the pipeline size problem. If you put all of these wonderful healthcare systems in the same room with the same checkbook and say, this is going to cost, but we're going to come out with double, triple, quadruple the number of graduates. It can be done. Susan did a nice job of articulating our history. We know the college can handle it, but we need that financial resource that only our healthcare providers can help us with. So thank you very much. Great conference.
Thank you. And I did see a comment in the chat by Raylyn that the K through 12 system, and I'm thinking are you thinking of adult ed or the full K through 12 system? Raylyn is having challenges with educators as well.
I'm thinking K through 12, our high school health pathways, it's almost impossible for them to find instructors.
And definitely, and we have a lot of pathways in the city. We support them we have a regional health pathway community of practice that I've been running for about 5 years. And we have, the pipeline is there, the structure is there. Lyndon's been a part of that for the past 5 years, and we're very grateful for that. And as well, I just really want to say we are very grateful for everything you guys have done and all of our industry partners for placing our students in all of the healthcare specialties. It's pivoting during the pandemic with even the placements to allow us to produce graduates when things got really messy and still continuing to be very, very difficult. And just to all of your workforce, yourself and each of your institutions. Carter touched on it, talking about that burnout piece. And it's real. We want to prepare our students, such as Rachel was talking about, for that resiliency and being able to really be responsive. And then Lyndon was talking about being culturally equipped for, really that was a great wording there, because I'm culturally equipped to really connect with patients and communities, as well as peers in our system. How do we actually function? So I just, again, want to extend all my thank you to everybody. I will as well. I have an event coming up as peer responder program. It's a UC Davis program we're going to be highlighting. We have our speaker, who was a graduate of Sacramento City College and now is the clinical nurse specialist at UC Davis in the pediatric hospital. She's going to be talking about this very thing about burnout and looking at a resilience tool that they're using. And it's a peer responder program. It's a 2.5-hour event. There are CEUs and it's on December 3rd. So I'll put it in the chat. It's just a shorter event, but I want to make sure that I'm sharing that information. And then as well, and there's just an event, it's free. It's supported through my grant. In addition to that, looking at what programs do we have in the region, I do want to make sure I'm highlighting all of those. So I didn't know, was that Caitlin, or if you want to pull that up, just so we're really all really aware. And part to your point, Grant, of our stats aren't always like how many graduates do we actually produce each semester. We are producing graduates. We're trying to grow. We depend on our industry partners to be able to grow any of our health programs to actually, how do we place students for any type of internship? And you're all doing an amazing job. We're just trying to look at also how creative we can be with different types of placements. So this is the top part on this page. It just has some stats that can be used to help publicize programs. But on the page 2, if you could go down, Caitlin, this is my grid, I call it, the grid of all things good with healthcare programs in our region. We have over 30 different types of programs. And then there's also duplicates at all of the colleges, such as CNA, there's 3 programs. We look at down on AMT, we've got it at many, many colleges. Nursing is at 4 colleges. Farm Tech is at 1, interesting program, Cosumnes River College. Medical assisting, we have 2 programs, excellent programs. And respiratory care, we've got an awesome program at American River College. Lesser known ones, perhaps, optician we're going to be launching. But these are programs that we keep the bar high. We are also in the community college we are servicing students that are coming from diverse backgrounds, diverse experiences, and that is the mission and the cornerstone of equitable access to higher education. And it is an affordable education. So this is important. And then many of our programs have transfer pathways to our CSU for the bachelor's degrees, for really, particularly with nursing, we want to make sure we're preparing that workforce for those transfer degrees. We've got a great collaboration. All 4 of our colleges co-enroll with students halfway through the nursing program, and then they can come out with a bachelor's degree 6 months after they graduate for an associate degree, and they pay tuition for probably 3/4 of their education at a community college level. And then they come out with that beautiful bachelor's degree. And this is an awesome partnership. I don't know if Nancy James is still on the call here, but Nancy James created this with Tanya Altman, the CSU director of nursing and dean over there. And we've been servicing, I don't have the totals on the number of students we've done over the past, probably eight years, but they have done an amazing job of getting our students through with these collaborative tracks. And so I just would like to make sure that people understand that. And we do appreciate all the feedback, looking at diversity, equity, and inclusion down to the high school. How do we do that? In our community college programs, how do we do that to really have that meaningful part of our curriculum and action, as such as Linda was talking about, having action as part of that resiliency and carrying that full load when they get out for whatever specialty they're in is really, really important. And, you know, really, and then the art of teaching, you know, how do we make these partnerships to make sure we've got a workforce for our faculty, and as well as, you know, making sure we're remedying the burnout. I do think when I became a faculty member at nursing many years ago in pediatrics, and it was a good remedy for some burnout that I was experiencing in my field. And but it kind of reignited what I loved about my job. And so I kind of wanted to share sort of that personal experience that was important to my career, and the community colleges being a great place for us to really make sure we have opportunity for students.
Thank you, Julie.
So I'm going to toss it back to you.
Yes, thank you. I just really want to thank our industry and employer partners on this call. We know it's a great a contribution of time for you to come and inform us. And we know it has been a rough year and a half, and we're certainly not out of the woods, and we haven't figured this out, these pipeline issues yet. Also to thank all the faculty and workforce partners on the call. This hasn't been an easy year and a half for any of you either, having to negotiate student expectations and challenges when they couldn't move to the next step in their education. So really, you know, Julie is always an inspiration to us at wanting to address the hardest challenges facing the healthcare industry. So she's been a great partner. I think there were a lot of challenges raised here, but it sounded like there was some momentum to want to work together to solve them. And so that's always exciting. And I think, you know, someone said it, if not one person, maybe a couple, that this is an opportunity to think in new, innovative ways about how to solve these challenges. So, you know, I know in our organization, our executive director will frequently say, let's take the fences off. What's outside the box? So, you know, this has been a great opportunity to get that started. And I think as we explore that, you know, Grant's suggestion, you know, sometimes we just need to brainstorm and see what kind of other opportunities there might be out there. So thank you so much for your contributions. There's some resources for you in the chat. We will be following up with all of the event materials, the presentation, the recording will be available. And about 30 days later, we'll have a meeting proceedings report that we'll share out that will have key findings from this, as well as some detail from the event for you. So look for those materials. And if you have any partners, friends, or colleagues who weren't able to attend, you can share those when we send those to you. The benefit of the virtual environment is it can continue to be shared.
And I would like to also extend a huge thank you to Valley Vision, Renee and Caitlin and Angelina, and I'm looking around there, but and Los Rios Community College District for funding these industry in the North Far North for their consortia for looking at funding this type of industry connection that's really important for our region. So again, thank you everybody, and have a great afternoon, and look forward to next steps.
Thanks so much.